But we begin at 5:30 with the shift in focus for Ohio's coronavirus vaccine. As we first reported last night, frontline workers who did not get their shots already are being told they have to wait.
That's because Ohio's focus has now switched to phase 1B of its rollout to protect the elderly. But what does that mean for workers still waiting to get their shots? News 5's Tracy Carlis spent today getting answers.
When the first vials of the COVID-19 vaccine made it to Ohio, frontline healthcare workers were at the front of the line as part of the state's 1A distribution group. Northeast Ohio hospitals started vaccinating their workers in mid to late December. Cleveland Clinic workers started rolling up their sleeves on December 16th. The state moved to the 1B group made up of Ohioans 65 years old and older yesterday, with those 80 and older eligible.
Just take a seat and sit for 15 minutes.
It came on the same day the CEO of the Cleveland Clinic sent a message to employees saying in part, "We received new directives from the state of Ohio late last week. Healthcare organizations, including Cleveland Clinic, will turn to vaccinating patients. I understand how this feels if you have patiently waited your turn or unable to schedule or still deciding to participate. While we have made strong progress vaccinating caregivers, we have been limited by vaccine supply." The Cleveland Clinic says this letter is the second time workers were told of upcoming changes in state guidelines, the first on January 15th. And it's something the governor said at a news conference last week, warning hospitals statewide.
We are telling the hospitals today that they need to finish that up. They need to finish it up by midnight on Sunday, because on Monday, they need to move then to vaccinate those older Ohioans.
On the News 5 Facebook page, one woman said, "I am actually a caregiver and wanted the vaccine but was unable to get it because they had no appointments available before they were supposed to shut down the vaccinating hospital employees. They didn't have enough vaccine to give all employees, yet offered to every single employee." We reached out to that woman who commented, but she said, "I am going to decline at this time." Meantime, the Ohio Department of Health did respond to News 5. They said in part, "There is no end date for phase 1A, and we still want our frontline healthcare workers to get vaccinated. However, as we move into phase 1B, there are less vaccines that will be going to hospitals for healthcare workers, and they should no longer be distributing the vaccine to their staff. That should have already taken place." The Cleveland Clinic said in a statement in part, "We have vaccinated more than 29,000 of our caregivers, representing 57% of the Ohio workforce, following the deadline provided by the state for phase 1A. Because this is a state mandate, other Northeast Ohio hospitals are following the same guidelines. The Metro Health System said in a statement, "We will continue to protect our employees likely to come in contact with COVID patients per the governor's guidance, but our main focus remains on vaccinating patients in phase 1B. And University Hospitals said, per guidance from Ohio Governor Mike DeWine, UH is no longer scheduling any new phase 1 vaccine appointments. If an employee had previously received a first dose, UH plans to vaccinate them with a second dose as scheduled."
Tracy Carlis reporting on that right there.